While many umbilical cord functions as required, in rare occasions, there might be some special circumstances. And these special circumstances with umbilical cord, or the complications with umbilical cord, is what we are going to be discussing in details in this video. And the essence of this video is to provide relevant information, reassurance, and empowerment for pregnant and expectant or to be moms and their families. So grab a cup of drink, sit back, and let's inform ourselves. Hello and welcome once again aboard JulieCity. As usual, I'm always excited to be here, and I'm glad you are here. Thank you for clicking to watch today's video. You're highly appreciated. A healthy umbilical cord is essential to the growth and development of an unborn baby during pregnancy. The umbilical cord has 2 arteries and 1 vein. Now, think about it as the smiley face. Yeah, 2 lovely eyes and 1 smiley lips. So 2 arteries and 1 big vein. The vein is responsible for carrying relevant nutrients and oxygen from the placenta to the baby, and the 2 arteries are responsible for carrying waste products from the baby back to the placenta. The umbilical cord, according to research, starts developing from 4 weeks of pregnancy, and it can be even up to 22 inches long. The length or size of the umbilical cord in pregnancy cannot be influenced by you and I. It is just natural, genetics, or whatever. Now, what we see mainly when we talk about umbilical cord is what is called the Watson's jelly. I'll put the spelling on the screen. And that is the squishy substance, or what we feel when we say an umbilical cord. And that squishy jelly serves as a cushion and protection for that 1 vein that does crucial jobs and 2 arteries that equally does crucial jobs. So as a midwife during training, you're taught to be able to identify them. And when a baby is born, one of the examinations that is done is to check the placenta. And one thing we also check is the umbilical cord to make sure I have my 2 lovely eyes and 1 smiley lips. It is that important because of the vital role that it performs during pregnancy. And at the end of pregnancy, when baby is born, the umbilical cord is delayed, clamped, and cut, and it's only the little bit that is left with the baby clamped tightly until it falls off, probably different for every baby, 7 to up to 20 days. Now, like I said in my intro, most pregnancies and most umbilical cords go healthy and carries through them, does what they need to do, provides a relevant line to supply baby with the nutrients and oxygen and take away waste products from baby back to placenta. However, some special circumstances, or what generally medically is known as complications, do arise, and these are the ones we are going to be discussing. These special circumstances include the cord being too short or too long, the cord being compressed, the cord coming before baby during birth. It can be the cord attaching wrongly, a missing artery, and so on and so forth. I will provide all of these details as we go on in this video. At this point, I will ask, have you subscribed? If you have not, then click that subscribe button. I would really appreciate it. Come join us. Let's learn together aboard JulieCity. And please like this video, share to those who will find it insightful, and leave your valuable comments. We all learn together. So, The first special circumstance or complication that can arise with umbilical cord is the knuckle cord, and I have completed that topic in a separate video before this one, so I'll encourage you to click and watch after this. I'll leave it at the end screen at the end of this video and in the description box, so do well to watch after this. Knuckle cord is, simply put, cord wrapping around baby's neck. This is very common but not as dangerous as some make it. Watch that video to get the full story. The next point we'll be discussing is the cord being too short or too long. Now, with this circumstance, there's absolutely nothing we can do about it. It is just one of those things that we have no control over. If the umbilical cord is too short, it could restrict the movement of the baby. And we know that movements of baby in the womb is one way they grow and thrive or develop effectively. A shorter umbilical cord can also increase the risk of breaking. So it can snap away from the placenta, leading to what is known as placenta abruption. Typically, according to research, a cord that is under 13 inches long could be described as a short umbilical cord. So, a short umbilical cord can generally impact on the growth and development of the unborn baby. If the umbilical cord is too long, and according to research, too long means up to 30 inches long, it could equally impact on the movement of the unborn baby. It could entangle, wrap around the baby's neck, have a tie on it, proper knots on it, and might also cause other more severe conditions. But I always tell you, this information is more for providing knowledge, reassurance, and empowering you. The most important thing to do is always attend your antenatal appointments and attend your ultrasound appointment as required. By doing so, these things can be detected early and treated or managed accordingly. The next one is a through knot. So a through knot is when an umbilical cord ties and makes a knot, like described or shown on the screen. This invariably means that it could restrict oxygen and relevant nutrients the baby needs to thrive in the womb. With the restriction of nutrients and oxygen to thrive, it becomes a serious condition. Through knot is common with an umbilical cord that is too long, or even with twin pregnancies, especially identical twins who share the same amniotic sac. So that's that bag of fluid that surrounds a baby. Identical twins share one sac. So with having two means having restricted space, and this can lead to entangling of their umbilical cord, which may cause through knot. If this is pulled tighter, it can actually be very serious. Again, attending your antenatal appointments cannot be overemphasized. It is very important to attend your antenatal appointments and any scan appointments that you've been scheduled to do. And if you have any concerns at all, don't hesitate to speak to your midwife or doctor looking after you in pregnancy. Through knots can also be caused by polyhydramnios, and that is when the fluid that surrounds your baby is a lot. That will allow baby to have access to a lot of space and move so much that it can get entangled, leading to a through knot. Again, we honestly do not have control over this, but attending your antenatal appointment again cannot be overemphasized. If you notice any change in the movement of your baby while pregnant, different from what you're used to, please speak to your midwife or doctor looking after you in pregnancy. A stitch in time saves 9. See it, say it, sort it. Cord compression, as the name implies, means that there's something compressing or pinching the cord. This could be the baby's weight, the wall of the vagina, or even the placenta. Cord compression can happen during pregnancy as baby moves. It can be during labor as a result of contraction, or during birth when baby is navigating the birth canal. A temporary cord compression is not a problem and it will always resolve itself. In a situation where mom is being monitored during labor, it will be identifying as baby having a reduced heart rate. This will usually resolve itself, and if it intensifies, it might cause more damage. This is the point where the doctors might seek to interfere in order to prevent a lasting damage, because this compression means that baby is not getting enough oxygen, and if baby is starved of oxygen for too long, that might cause brain damage. Cerebral palsy, which is when the brain is starved of oxygen, some part of the brain stops functioning, leading to cerebral palsy, which impacts on not just the baby as a baby, but the person for the rest of their lives. It can also lead to what we don't want, which is death of the baby. The doctors may kick in to want to intervene by offering assisted delivery or even cesarean section, depending on the case. That is why it's important to keep informed and empowered. So if ever you find yourself in that situation, you'll be able to make the best decision for you, your unborn child, or your baby. The next one we will look at is the missing artery. Remember, we talked about that smiley face, 2 arteries and 1 large vein. In certain situations, an artery might be missing. A single umbilical cord artery might impact the function of the umbilical cord during pregnancy. It is usually detected by an ultrasound in the second trimester of pregnancy, and if this is the case, then close monitoring will be required. And even in some cases, baby might need to be delivered prematurely, especially if it is impacting on the growth and development of the baby. Can affect baby's heart function, the kidney, and even other vital organs of the body. Every case is different, and depending on the gestation of pregnancy, a decision will be taken, with you, of course, at the center of it. Next on our list is umbilical cord prolapse. Umbilical cord prolapse is when the cord goes ahead of baby during labor and birth. So, while baby is navigating the birth canal during delivery, usually we don't want anything in the way, except if baby is being born with its sac, then we feel a bit of water. Otherwise, it has to be clear passage. But in very rare occasions, the cord drops and goes ahead, and this is a serious situation, an obstetric emergency. This could arise as a result of having a preterm baby. Preterm means before 37 weeks gestation, having a baby that is too small for their age. It can also be as a result of multiple pregnancies, so having more than one baby, that could happen. It's possible when the labor is quick and swift, it could lead to that. Too much fluid in the amniotic sac, what is known as polyhydramnios, could also create more space than necessary, leading to the umbilical cord to drop before baby's head while baby is navigating the birth canal. It could also be as a result of the fact that the umbilical cord is too long. Like I said, umbilical cord prolapse is an obstetric emergency, and if one is birthing at home, then it will be a case of the midwife doing what they know how to do. Remember, they are taught to manage these emergencies to protect you and baby as much as possible until help arrives for transfer. if one is having baby in the hospital. Then you'll be told and you will hear the emergency alarm go off, and there will be a few professionals running into the room to assist, and this most likely will end in a cesarean session. I believe the most important thing is to be informed, prepared, and empowered to make the decision and stay calm as much as possible, because it could be a frightening situation. Like I said, it's rare, but it does happen. Cord prolapse happens mainly during labor and birth, like I said, and it's either identified during labor when the midwife is carrying out an examination, or becomes visible when baby is navigating to be born through the birth canal. Either way, it is an obstetric emergency and action is usually needed immediately. The next one is the vasa previa. Simply put, it is when one of the blood vessels in the umbilical cord passes in front of the cervix, which is the opening of the womb into the vagina, and is not protected by the umbilical cord or the placenta. If there's any slight compression, it might burst because it's vulnerable, since it doesn't have that protection wrapped around it, and that means it might rupture. And when a blood vessel ruptures, be it for adults or for an unborn baby, it is usually critical. This condition can be identified during routine ultrasound. If so, then a planned cesarean section is usually offered to avoid stories that touch. But at the end of the day, the final decision will still come from you. But I know that with your brains, you'll be able to make the right decision for you and your unborn child. Again, I'll reiterate, when it comes to the umbilical cord, special circumstances or complications, most of it is outside of anyone's control. However, a few things have been identified, like maternal health, hypertension, preeclampsia in pregnancy, too much amniotic fluid, breech presentation, and even some genetic factors can lead to some of these situations with umbilical cord. For example, too lengthy an umbilical cord can increase the chances of cord prolapse or through tie. Too much amniotic fluid, also the same thing. The biggest factor here is get informed, and thank you, you're doing that already by watching this video. Umbilical cord complications can be very concerning for expecting parents. Remember, some of them are harmless and can be easily managed. Others are very rare, like the vasa previa. Your part in this is to gain knowledge, gain understanding that will empower you to make relevant decisions and choices if the need arises. It's equally important that if you feel any concerns at all during your pregnancy, labor, or even at birth, that you speak to your midwife or doctor that is looking after you in pregnancy, because early detection is vital to a better outcome. I hope you found this information insightful. If so, I'll advise, if you've not yet, to please like this video, subscribe if you have not, and share. Remember, the comment section is yours to throw more light on some of these issues that I've covered in this video. You can share your experiences or even educate us using the comment section. And until I see you in my next video, don't forget, your health is your wealth. Remember to click on these videos that are popping up. I'm sure you find them equally insightful.